Thank you very much, Mr. Speaker. It is my great pleasure today to begin debate in the House of Commons on my private member's motion M-388 about firefighter safety. After years of patient and persistent presentations to various parliaments by firefighters from every corner of Canada, M-388 draws together in one motion the three specific requests that Canadian firefighters have been making over the years to achieve greater acknowledgement of the risks inherent in the work that they do. None of us can doubt for a moment how valuable these courageous men and women are. On a routine basis every day, they put their lives on the line so the rest of us can live in safe and secure communities. And it's not just about fighting fires, as crucial as that in itself is. It's also about being first responders, the people most likely to be on the scene first in response to all manner of emergency situations. It might be a traffic accident. It may be a hazardous spill. It could be a heart attack or a drowning. It could be a house fire or an industrial blaze like the one that lit up Winnipeg just a couple of nights ago. Whenever Canadians reach for the phone and dial 911, they expect top-notch rescuers to be on the road in seconds to help them out of a dangerous situation. Lives are at risk. The circumstances could be and likely are perilous for both the victims and the rescuers alike. But we know that we can count on the skill and expertise of Canadian firefighters to respond quickly, in the most effective manner humanly possible, and with the bravery and the compassion that these situations often demand. And here's a sobering statistic, Mr. Speaker. Every year in Canada, on average, some 18 firefighters give their lives in the line of duty. On the one hand, some may say that that sounds like a low number, but think about it. It means every 3 weeks, somewhere in Canada, a firefighter dies on the job. Every 3 weeks, the ultimate sacrifice in service to the public so others can live and be safe. I think it's appropriate and proper for the Parliament of Canada to examine ways in which the Government of Canada can respond constructively to the three simple ideas that Canadian firefighters have been advancing for years to better promote their safety. It is a matter of common sense. It's a matter of fundamental respect for the invaluable service performed by these members of our society. These are issues that cut across all party lines, and I am grateful for the support and encouragement for 388 that has come from all sides in this House. Let me also thank the International Association of Firefighters and a great many other individual firefighters, both professional and volunteer, along with many other public safety officers in this country who have endorsed this motion and urge all Canadians to get behind it. The 3 points that are covered in 388 are these. First, the motion recommends to the Government the creation of a public safety officer compensation benefit. This would be a one-time payment of $300,000 to be paid by the Government of Canada to the family of a firefighter or any other public safety officer who is killed or permanently disabled in the line of duty. In principle, this is not unlike the Community Heroes Fund that was in the public domain for debate a few years ago, and it was a very popular concept. The idea acknowledges the service and the sacrifice of those whose jobs inherently put them at risk to protect the public. It helps to ensure their families are well taken care of. A public safety officer compensation benefit parallels certain provisions in some federal collective agreements, for the military and for the RCMP, for example. But sadly, for most Canadian firefighters, they are simply not in a position to bargain for a provision like that, or their employers, usually municipal governments, are not in a position to provide it. So M-388 offers a way to treat all public safety officers equitably while fully respecting every level of government jurisdiction. And the estimated cost of this measure is in the range of just $10 to $12 million per year. On an annual federal budget of more than $250 billion, the annual cost of a public safety officer compensation benefit is equivalent to the tiniest of rounding errors. It is also worth noting that a similar benefit has been in effect in the United States for decades, since 1976, a federal benefit provided to all U.S. firefighters at every level as a gesture of national responsibility and respect. The second major feature of Motion 388 deals with the priority lists that are prepared by governments to serve as guides, not binding legal edicts, but guides for the distribution of sometimes limited volumes of vaccines and other drugs during pandemics and other public health emergencies. The basic question, Mr. Speaker, is who gets the vaccine first? It's a tough judgment call. Difficult choices have to be made. In broad terms, when you look at the protocols from previous pandemics, there are three general categories of vaccine recipients. The first, of course, is those Canadians who are most vulnerable and at the greatest risk of getting sick, the primary victims, if you will. The second category, with virtually equal priority, is those primary health care givers who take care of those vulnerable people and those at greatest risk. And then third, there is the general public. Within these broad groupings, there are certain subsets, but the concern of firefighters is that this general hierarchy of priorities for receiving vaccines during public health emergencies appears to rank firefighters in the third category, that is, with the general public, or at the very bottom of the category about caregivers. Firefighters submit, and I agree, that as guidance to those who carry the serious responsibility to implement vaccine sequencing during emergencies, firefighters should consistently be at the top of the grouping of caregivers, as is the case in the United States and in many other jurisdictions. And I say this for two reasons. First, at all times, and especially during times of public stress like a pandemic, Canadians need to know that their crucial public safety agencies, like fire departments, are fully functional, fully staffed, up to strength, and ready to go no matter what. We don't need and we don't want a compromised firefighting system on top of a pandemic. But secondly, and even more importantly, most firefighters are first responders who function as frontline healthcare workers dealing in raw circumstances with people in trouble, in traffic accidents, and so many other emergency situations. They do the initial rescue, the assessment, the first aid, the primary treatment. During a pandemic, they will undoubtedly be exposed to people in respiratory distress and suffering other ailments. Firefighters need to be able to do their frontline, first responder, health care worker jobs with full confidence and the full assurance that they are as secure and functional as humanly possible. If firefighters cannot do that job at the scene of a public emergency, then at least some of those suffering from pandemic diseases will simply not make it to the doctors and the nurses who will be waiting for them in the emergency room. Finally, Mr. Speaker, M-388 deals with the National Building Code of Canada. It makes the simple and logical point that firefighter safety should be included among the objectives of that code. It's not already there, you ask? That's a question that a lot of Canadians have asked. And the answer is, well, in the United States it's there, and in many other countries it's there, but not clearly in Canada, especially with the advent of rapidly changing construction techniques and building materials. 25 years ago, a typical building might take 15 to 20 minutes of burning before it became a full-fledged blaze. And that left a fair bit of time, obviously an urgent situation, but a fair bit of time for firefighters to arrive on the scene and to rescue people and property from the scene of the fire. But today, what used to take 20 minutes 25 years ago may now just take 3 or 4 or 5 minutes. And it's not good enough to say building code standards designed for, quote, occupant safety serve just as well to achieve firefighter safety. The two are not the same for this fundamental reason. While occupants will be doing their very best to get out of a burning building just as fast as they can, firefighters, by the nature of their jobs, will be going into the building, into the teeth of the blaze, to work as long as they can to rescue victims and fight the sources of the fire. And that's why firefighter safety needs to be specifically included in the code. And that's also why the government needs to review the code urgently, and to do so in cooperation with firefighters themselves and other experts that can identify the areas that need to be addressed and work on the best possible solutions. Well, Mr. Speaker, that's it. 3 simple things in motion M-388. First, an affordable benefit for the families of public safety officers killed or injured on the job. Secondly, an appropriate high-priority ranking for firefighters to receive vaccines during pandemics, particularly in their critical role as first responders and healthcare workers. And thirdly, the inclusion of firefighter safety in Canada's National Building Code. These measures have huge support among firefighters and most Canadians across the country. They are practical, modest, fair, and reasonable. They are consistent with international standards. They are important gestures of respect from the Parliament of Canada to the firefighters of Canada. And I would ask all of my colleagues in the House of Commons to support these measures during this debate and to support 388 when it comes to a vote later this year. Thank you.
Question.